Hello everyone, Mr. Cash is back at it again, and this video is requested for aerosol drug therapy. Please forgive me if I make any mistakes. I will try my best to explain this and to go over it. Now let's start. So like I always do, I will start from the beginning. So aerosol drug therapy. Now define the term aerosol. This is what we're going to be doing. We're going to define the term aerosol. We're going to define what aerosol means. Describe how particle size, motion, and airway characteristics affect aerosol disposition. So we're going to describe the particle size, motion, and the characteristics, and how they are affected by disposition. Describe how aerosols are generated, how aerosols are made. So we're going to explain that at the end. List the hazards associated with aerosol drug therapy. What are the hazards, the side effects, and what we have to be cautious of. Describe how to select the best aerosol drug delivery system for the patient. So we're going to describe how every patient is going to get a certain device to get the aerosol delivered to. Describe how to initiate and modify aerosol drug therapy. State the information patients you need to know to self-administer drug aerosol therapy properly. Then we're going to describe how to assess patient response to bronchodilator therapy at the point of care. And we're going to describe how to apply aerosol therapy in special circumstances. Describe how to protect patients and caregivers from exposure to aerosol drugs. This is very important at the bottom. Protect the patient and caregivers from exposure to aerosol drugs. Then we have the chapter outline. We have characteristic of therapeutic aerosols. So first we're going to start with the characteristics. Hazards of aerosol therapy, aerosol drug delivery system, and then assessment-based bronchodilator therapy protocols, and then special considerations. So I like to go back to all of this while I'm in the chapter, so I can understand it. So let's begin with the beginning of the first paragraph. Boom. Now we started. As we can see here, an aerosol is a suspension of a solid. Oh, I didn't go over this. These are some key terms to understand, but as you go through them, the key terms will be down in the chapter. So let's start with the first paragraph. Let's start reading. An aerosol, so this is going to define, this is what's going to tell us what does aerosol mean. So this is going to give us the meaning. And if we go back here, it was one of our first goals is to determine aerosol. So now, since we have it, we can just write it down over here, or we'll put it under this, so that way it stays in our mind when we review the chapter. So let's go back. An aerosol is a suspension of a solid or liquid particles in a gas. So now let's get our little paper here. We write it down. We're going to put aerosol is a suspension of solid or liquid particles in, I'll say, a gas. Boom. So this is our definition of aerosol So we can go here and we can write it down here. This is just the meaning of aerosol. It is a suspension of a solid or liquid particles in a gas. Now, we already know here, aerosol is a suspension of a solid or liquid particles in a gas. Now let's understand what it means. Let's say I have gas here, right, in a container. If we go back to physics, we know that a gas fills the shape of their container, okay? And the molecules are far apart from each other. Right now, right here in this space here, we have molecules. We have some type of gas here. Now, aerosol, what it means is you suspend a solid or liquid water in a form of solid or liquid, like water and ice. When it's a solid, it's ice. But let's say we have some type of other, like drugs. We can make them a liquid and we can make them a solid. So an aerosol is the suspension to put it on that air, to have it carried away with the air of a solid or liquid particles in a gas, in some type of gas. So what we're doing with aerosol is we are suspending that liquid or solid in that gas. Let me look for another term for suspension so we can make it easy for us to understand for those of you who doesn't understand. So we can get another term for suspension. So we got different words, but it will make you confused more. What it means is rest on. It's a rest on. So aerosol is something that you rest on a solid or a solid or liquid that you rest on a gas. Basically, you'll understand what it means right now. Let's just keep moving. Aerosol occurs in nature as pollutants. This is how we see them. Spores, dust, smoke, smog, fog, and mist. So when you come outside and it was a raining day or not, and then you see all that fog, so that's particles are suspending on the air. So when the day is fogging, those particles, whatever they are, they can be pollutants, they could be smoke, they are suspended, they are a type of aerosol suspended on that air that is surrounding you. The upper airway and the respiratory tract filter out large particles to protect the lungs from invasion by these aerosols. So key term here, this is important. So the upper airway, like the nose, they filter out large particles to protect lungs from invasion by these aerosols, but the only they protect is large particles. But if the particles are small enough to bypass, they will not be blocked. In clinical settings, medical aerosols are generated with atomizers, nebulizers, and inhalers. Aerosol can be used to deliver blend water solutions to the respiratory tract or to administer drugs to the lungs, throat, or nose for local and systemic effect. This chapter focuses on the principle of medical aerosol drug therapy. The aim of aerosol therapy is to deliver a therapeutic dose of the selected agent, drug, to the desired site of action, nose, throat, airways, or deep lung. The indication for any specific aerosol is based on the need for the specific drug. Administration of drug by aerosol offers higher local drug concentrations in the lung with lower systemic levels compared with other forms of administration, improved therapeutic action with fewer systemic side effects, provided a higher therapeutic index. Okay, here they mentioned that this chapter is focused on principal medical aerosol drug therapy. And that's what we're going to be focused on. The aim of aerosol therapy is to deliver a therapeutic dose of the selected agent drug to the desired site of action. The indication for any specific aerosol is based on the need for the specific drug. Administration of drugs by aerosol offers high local drug concentrations in the lung, which lower systemic levels. Okay. Now let's move on to the characteristics. But before we move on to the characteristics, I want you to understand two things. I don't want you to be confused though. Aerosol what did I do here? Make sure you understand these two differences. Aerosol and humidity. I do not want you to be confused with those two. Aerosol and humidity. Humidity is water vapor that you're gonna put in a gas, but okay, I'm back there. Okay. So I want you to understand this before we move on with this chapter. This is very key, so I want you to clear it off your mind. So aerosol and humidity. Aerosol is any type of drug. It's going to be large particles that you suspend on that air or that gas you're delivering to the patient. Aerosol will be visible. You can see it. So I'm going to put here, visible. Humidity is going to be not visible. When you give humidity to the patient, it will be not visible. You will not be able to see it with your naked eye. So visible, the aerosol, any aerosol generated procedure, you're gonna see it. You can see it with your eye, like mist, like they included here. Here they included that aerosol occurs in nature as pollutants. You can see them: spores, dust, smoke, smog, fog, and mist. So there's a mist, you can see it with an aerosol, but with the humidity, you will not be able to see it. Water vapor cannot be seen. So like we have a lot of water vapor right now in the air, we cannot see it. So that's humidity. I will find a picture on the laptop for you to understand it. So this here, as you can see here, this is aerosol. Do you see the mist right here? You can see it visible. This is a small volume nebulizer. This is an aerosol. You can see it's visible. Now I'm gonna get a photo of a bubble. The bubble humidifier. Most of you will see this in the hospital. This is for nasal cannula. This is when you give humidification. It's a bubble humidifier, and water is inside and it just bubbles since it spends some of the water vapor on the into that gas that you're delivering to the patient, which is oxygen in some cases. So you cannot see humidity, you cannot see water vapor. Okay, that's the difference. So understand that aerosol, humidity are two different things, and they have different characteristics. Let's move on. So, characteristics of therapeutic aerosols. Effective use of medical aerosol requires an understanding of the characteristic of aerosol and their effect on drug delivery to the desired site of action. So, what they're saying here, effective use of medical aerosol requires an understanding. In order for you to use these aerosol medications effectively, so I'm gonna put here effective aerosol meds right? So you need to understand the characteristics of aerosol. Basically, you need to understand where you want to administer or to deliver the desired site of action. So what it means is where you want to deliver the desired site of action. In other words, where do you want the medication to be? I'll probably confuse you here a little bit. Okay, so here they said, if we go to the first paragraph here, okay, they said, where do you want it? Okay, let's see. Administering aerosol affect high liquid concentration based on, okay, compared with the, okay, they include here, okay, here, or to administer to the lungs, throat, nose, or local systemic effect. So you need to understand the characteristics so that way you can understand where do you want this drug to be delivered to. Either you want it to be administered to the lungs, just the throat, or the lower, the like, okay, what I mean is, like, if you want, where you want the medication to be at, trachea or lower airways or the throat. So let's just keep going. I don't want to waste time. Effective use of medical aerosols requires an understanding of the characteristics of aerosol and their effect on the drug delivery to the desired site of action. Key concepts include aerosol output, particle size, disposition, and change in aerosol over time, aging. Okay, so they put aging here. Okay. So this is a key concept to include aerosol output, particle size, so the size of it, and how is it delivered, the position, and where does it go. So now let's start with the first one, aerosol output. Aerosol output is the mass of fluid or drug produced by an aerosol generator. Output is described as the mass of drug or liquid emitted leaving from the aerosol generator. For nebulizers, the output rate is the mass of aerosol generated per unit of time. Output varies greatly among different nebulizers and inhalers. For drug delivery system, emitted dose, leaving dose describes the mass of drug leaving the mouthpiece of a nebulizer or inhale as an aerosol. Aerosol output can be measured by collecting the aerosol that leaves the nebulizer on filters and measuring either their weight or quantity of drug. Gravimetric measurements of aerosol are easier but less reliable than drug assay techniques because weight changes with water. With water evaporation, while drug mass does not. A drug assay provides the most reliable measurement of aerosol output. Large proportions of particles that leave a nebulizer may never reach the lungs. The ability of aerosol to travel through the air, enter the airway, and become deposited in the lungs based on a numerous variables range from particle size to breathing pattern. Understanding and skillful manipulation of these variables can greatly improve pulmonary delivery of aerosol. So what they're saying here is the size of the particle, basically the amount that is going to be delivered. We have different devices. The output is where it comes from, how many, the amount of medication in that specific time of gas. And also it depends on breathing pattern. They included here at the bottom where they say particles ability of nebulizers, and then they include variables from particle size to breathing pattern. So it depends on the particle size and the breathing pattern. So this will you will understand this, that it can affect how when you breathe, where to lead the particle of medication that you want it to go to, either to the upper airway or to the lower airway or to your lungs, and how deep in the lung you want it to go, how far to go. Now let's go to particle size. Aerosol particle size depends on the substance for nebulization, the method used to generate the aerosol, and the environmental conditions surrounding the particles. It is impossible to determine visually whether a nebulizer is producing an optimal particle size. Optimal just means the right amount of size. The unaided human eye cannot see particles less than 50 to 100 ucron in diameter. Okay, we understand that small giant of sand, this is equivalent to a small grain of sand. The only reliable way to determine the characteristics of an aerosol suspension is laboratory measurements. So you can only measure it in a lab, because it's impossible to just by your eye looking at it and see the particle size. Because remember, it's like a mist, so you can't really know what size of that particle is in there. The two most common laboratory methods used to measure medical aerosol particle size distribution are as cascade impactions and laser diffractions. So this is just gonna tell us how they measure them. Are they designed to collect aerosol of different size range or a series of stages or plates? The mass of the aerosol deposited on each plate is qualified by drug assay, and the distribution of drug mass across particle size is calculated, and laser differentiation, a computer is used to estimate the range and frequency or droplet volumes across the laser beam. This here doesn't concern what we do as respiratory therapists, doesn't concern us, because here they go more into laboratory, how the aerosol particles are measured. This has nothing to do with us. This is very detailed. Because medical aerosol containing particles of many different sizes, they go deep into how it's measured. So I'm gonna skip this whole part, because I feel like in this chapter, this is like, I understand that aerosol has to be a specific size of molecule or particle suspended on that gas, but how do they measure it? They use computer, they use lasers. That doesn't concern me, because I don't understand how that does that concern me as a respiratory. I'm just gonna keep moving on. Deposition. When aerosol particles leave suspension in a gas, they deposit on, attached to, there we go, that's another word, attached to a surface. Only a portion of the aerosol generated and emitted leaving from a nebulizer may be inhaled. A fraction of the inhaled dose is deposited in the lung. Inhaled mass is the amount of drug inhaled. The proportion of the drug mass is particles that are small enough, fine particle fraction, to reach the lower respiratory tract is the respirable mass. Not all aerosol particles delivered to the lung are retained or deposited. A small percentage, 1% to 5% of inhaled drug may be exhaled. Whether aerosol particles that are inhaled to the lung are deposited in the respiratory tract depends on the size, shape, and motion of the particles, and on the physical characteristics of the airways and breathing pattern. Key mechanisms of aerosol deposition include inertial impaction, geometrical sedimentation, and Brownian diffusion. Again, this here is useful. You can read it. You can read it from here. And you also can read here. But I don't think I will ever, like if I was studying for a test, I don't think they will ever include this in a test. Let me move on. Same thing here. There's so many things here that is okay. This chart here is important. Range of particle size for common aerosol in the environment, and the influence of initial impactions, sedimentations, and diffusion. Okay. Deposition fraction, pulmonary, tracheobronchial, medical aerosol. So size of it and how it can and where it can land, basically. Rule of thumb: the size of deposition in the respiratory tract varies with the size of the particle. Use the nebulizer that produce particles in a specific size range. Improves the targeting of aerosols for deposition to the desired site in the respiratory tract as follows. Aging, they go into aging and stuff like that. Quantifying. This is a lot of physics and stuff here. I don't want to go and waste your time on that. Infection. Okay, hazards of aerosol therapy. This is very good. Okay, now we're gonna move on to that, because characteristics of it is just too much for you, and you're gonna confuse yourself, and it's not gonna be helpful. Okay, now let's start with infection. Hazards of aerosol therapy. The primary hazard of an aerosol drug therapy is adverse reaction to the medication being administered. Other hazards of the patient include infection, airway reactivity, systemic effect of blend. Okay, this is very important. So now I'm gonna get my piece of paper that I wrote on. I'm gonna add to my notes hazards of the aerosol. So the first one is, okay, it says the primary hazard of the primary, so this is number one, the primary hazard is the adverse reaction to the medication being administered. Action to the medication being administered. Okay, so what does this mean? Aerosol, visible, right? Aerosol, it is visible. You can see it. One of the hazards of it is adverse reaction to the medication being administered. One of the number one hazards, and it's the primary hazard, is when you administer that medication. Let's say, for instance, you give there was an order for a patient for Donep. Donep is combined of albuterol and ibuprofen. So let's say you are giving it to a patient and you put it in that small volume nebulizer and you give it to the patient. Now you see the aerosol is going to the patient, and after like 5 minutes or 3 minutes, the patient heart rate goes up, his blood pressure drops, his oxygen saturation goes off, and he's panicking, he's breathing too much, or he's breathing less, and his heart is pumping. That's adverse reaction to the medication being administered. Stop the medication as soon as possible and inform the doctor. Let the doctor know what happened, and make sure you document it on your notes. That's number one. Let's move to the second one. The second hazard, infection. This is important. Infection. When administering, okay, I will explain that. Infection of aerosol. Now, as you all know, we've been through the pandemic, the coronavirus. Infection. Every aerosol that we had to deliver in a room, the patient must be by themselves, like a small volume nebulizer. We cannot put two patients in the same room, because if one of them has corona and you're giving him a small volume nebulizer, you are suspending a lot of particles on that. It's an aerosol room, unless there is a negative pressure room. If it's a negative pressure room, then we can do it. Otherwise, they'll be by themselves. Even if it's a negative pressure room and there's another patient in the room, they cannot be. That was a no-no. When we deliver aerosol, we tried during the pandemic to lessen delivering an aerosol as much as possible. We converted most of the medications to an MDI, just an inhalation, so the air is not aerosolized. That medication is not aerosolized, because you can spread infection easily when you do a procedure, aerosol generated procedure. Okay. So second one is airway reactivity. And then eye irritation, they also included it there. I will just include it. Okay. So be aware of the hazards. This is important. Just be aware of them. Okay, let's continue. And then they will explain to you here in this paragraph about infection. Aerosol generators can contribute to nosocomial infection by spreading bacteria by the airborne route. I was just saying that about the coronavirus. The most common source of bacteria are patient secretions, contaminated solutions, multiple dose drug vials, and caregivers' hands. Offending organisms are primarily gram-negative bacilli and bacterial Pseudomonas. This is all microbiology. You will know. Okay, various procedure can be contamination and infection associated with respiratory equipment guide. Okay, keep going. That's the second one here. Airway reactivity. Cold air and high density aerosols can cause reactive bronchospasm and increased airway resistance, especially in patients with pre-existing respiratory disease. This is very important to know, that cold air and highly density aerosol can cause reactive bronchospasm, so your airway can be tightened on the patient and they can't breathe, increase in airway resistance, which means it's very difficult. Pulmonary and systemic effects. Let's go here. With the site of delivery being administered. So all this here, I'm gonna leave to you to read. It's all gonna give you. This is important to read. It's all just, I will just recommend reading, so that way you can understand a little better. I don't want to waste too much time on this video. I'm just giving you what's important. Okay. Okay, it's time for me to go. So we stopped at the devices, aerosol drug delivery system. And if you see in this video the person who requested it, you can continue reading, and then when I go over it you might understand it better. Maybe not. Those are some of the devices on this chapter. Alright, so I just want to, one more time I'll go over this. I want you to understand this, very important. You understand that an aerosol is visible, you can see it. Humidity, when you give humidity through a chamber, like for a CPAP or for a ventilator or a bubble humidifier, to just humidify that air that is going to the patient or the gas that is going to the patient. You cannot see it, it's not visible to your eye. Humidity, you cannot see it. Water vapor cannot be seen. Aerosol, they're all visible. Aerosol are delivered in different types of devices, different sizes. You need to understand the characteristic of it, and if you need to deliver it to different parts of the lungs and the hazards of it. Pretty simple. Okay, and that's about it up to this point. We will not go any further. If you have a comment, please write it down. Feel free to put any comment that you want, and that is concerning this video, and correct me if there's any mistakes, and please subscribe because it just motivates me, and hit the like button. Just gives me motivation to continue with these videos. And thank you, and have a good day, everyone.